It's always great to be here and to be at Age Management Medicine Group Conference and to meet all of you and interact, because in general in medicine, our preventive medicine approach is underprescribed in our standard of care practices and insurance-driven practices. So especially in the area of sexual health. So many people ask, well, how did you become interested in sexual health? Well, let me tell you, who isn't interested in sexual health, right? So the key thing is, when I came out of training at Emory University, really the ivory tower of medicine, I had one of my first patients who presented to me was a 63-year-old chief executive officer of a biomedical firm who had a previous diagnosis of ductal carcinoma in situ. Her physicians at Emory said, no, you can't be on hormonal management. And she said, my sex drive is so low, I can't orgasm. I'm a woman of the 60s. My sexual energy is so important to me. I'd rather die. Doctor, help me. Right? I'm like, oh, okay, well, I trained at Emory. Let me look at my doctor's bag. What do I have? What do I know that I can do to help this woman? Well, I cleared my doctor's bag. I didn't have anything. So I started looking online. I did the research. I met with other experts in sexual health. And I said, well, why can't I use vaginal estrogen for vaginal rejuvenation and dryness? Why can't I use testosterone? The research seems to support it. This was when I graduated Emory in 1999, my first patient in practice. And so I started working in this area and working on the importance of addressing these issues and complaints with my patients and giving them viable alternatives and looking at the research that supported my approach, and then working on a way to communicate it to my patients. So with today's lecture, we want to talk about and address the issues that keep our sexual health and vitality long standing, right, for many years. So, in my family, I always say we have a great sense of humor. We have to, My dad's 86, and my dad says his sexual health and vitality is really important to him. I have to watch him when he comes to my office that he's not getting extra shots of testosterone. It's important to him at 86. We say we look from the inside out, right? There's no age limit on intimacy, sexual health, and vitality. And it's important to reinforce that in our patients. So my objectives with this early morning lecture is not to put you back to sleep, but to really discuss the reasons for decreased desire in women and discuss feminine desire and feminine orgasm, and also the 7 keys to discovery that are involved in discovering why a patient has decreased desire and decreased orgasm, and give you some of my favorite therapeutic options. So the question is, does desire in women have to come first? And how do we achieve a continuous state of receptivity or turn on? So what I heard time and time again from my patients was, hey, I'm not interested in sex, but once I get started, I'm good. I'm okay. I like to be there. Do you hear that? Yeah. So they're like, okay, well, with men, desire precedes, right? With women, it's like, okay, get me started and I'm good. But it's the getting started part, right? So then I ask, how is she fueled and balanced and positively reinforced so that she is continuously generating the feminine sexual energy of desire, passion, and receptivity? So how do we embrace our feminine? How do we embrace our women and fuel them? So fueled in health, fueled in mind, body, and spirit, right? So that we're continuously receptive, open, and have that desire and passion for our partner. This is the model that we were taught, the linear stages of sexual response. And this is really a linear model, and I've taught this too. But it doesn't fit the feminine pattern as well. And with guys, so with this linear model, what is the number one turn on for a guy? Do you agree? Guys are turned on by their partner being turned on. So if she's turned on, he's turned on. So more than his pleasure is like, hey, I want her to feel pleasure. I want her to be happy. I want to meet her needs. And women often don't get that. I mean, time and time again in my practice, and I deal with 99% women, they don't realize this. So his turn on is me being turned on. Okay, hold on a second. Let me work on this. Let's see what I can do. So the partner's pleasure is their erotic stimuli. That's beautiful. The female sexual response cycle is a little bit more complex. So, right? It's not linear. Our jobs would be easier if it was, right? So it's a little bit more complex. But what did this tell me? Bassan actually established this model back in 2001 and been refining it. But for women, initial desire, that initial desire turn on or primary desire is variable. We don't often have that, after the initial stages of a relationship, especially. But responsive desire, secondary desire, is more accessible for us. So why is that, and what does that mean? Well, with the sexual response cycle, when Bassan described it, he said, initially you may start with a partner who's sexually neutral, but she has some positive motivation. Okay, I like my husband. I want to express love. I want to share and receive physical pleasure for sure. I want to feel emotionally closer, bring that intimacy and bond together, and to increase our own sense of well-being. We know sex is good for us. We know orgasm is good for us. So we want to have that too. So here we have a positive motivation, but we're not seeking it. So we start with nurturing the idea of willingness and receptivity. So be receiving of his actions and open in communication to say, hey, what are your sexual stimuli? What are your sexual stimuli? What turns you on? So as a female, what turns me on? Bring me coffee in bed, Okay, and so that's the start of the day. So that communication is important. So that willingness and receptivity in a relationship and nurturing that. So as you begin with interest in the sexual response, you're open, willing, and you're focused now on the sexual stimuli. What changes? You change and process this information biologically and psychologically. So your body begins to respond to the emotional intention of what sex is bringing you as a female. Okay, so this leads to, okay, I'm getting aroused, and your body will then follow suit. Okay, so it takes time sometimes, especially as women get older. Vaginal moisture and lubrication takes a little bit of time, so that the importance of the sexual stimuli, the arousal, and that foreplay is very, very important for vaginal moisture, arousal, and the biological response, right? So foreplay starts at breakfast, right? A cup of coffee.